Good evening, everyone. This is Stephanie Coleman with Kansas Lend. We're really excited that you could join us for a family education session on confidence in every smile, tools for a better oral health with Abby Richwine of the Oral Health Kansas nonprofit organization in Kansas. We're really excited to have her here tonight and sharing information. We're excited to have you on, and if you are watching this later, excited and happy that you have joined us and watched this information. Just a little bit about Kansas Lend. Lend stands for Leadership Education and Neurodevelopmental and Related Disabilities, hence the word Lend. We are a workforce training grant, but we support families of kiddos with autism and other related intellectual and developmental disabilities across the state of Kansas. And this is one of our ways, our family education series. So next month will be actually offered in Spanish only. So it will be Spanish on our OASIS training from Kansas Family Support Center. So want to do a plug for that, and I will be sending information about that later. So for now, I'm going to go ahead and turn it over to Abby. If you have questions, please put them in the question box. Abby, let us know if you want them to ask questions throughout or wait till the end or.
Yeah, either way, that's fine with me.
All right. So just put them in the question box and we'll get them asked and answered for you. So take it away, Abby.
Awesome. Okay. Well, thanks for having me. My name is Abby, like Stephanie said. I'm with Oral Health Kansas, and she already kind of gave a little background, but a little bit more. So we are a nonprofit organization dedicated to improving oral health for all of Kansas. We focus on increasing access for underserved communities, including individuals with disabilities. Currently, we're working on a project called Pathways to Oral Health, and this initiative brings together dental providers, associations, advocacy organizations, state agencies, managed care organizations, you kind of name it. The goal is to work together to identify where the gaps are, share different resources, and put in real strategies in place so that people with disabilities can really get the care that they need. And what makes Pathways to Oral Health special is that it's not just a short-term fix. It's really about building those long-term system changes through collaboration and shared commitment. So this evening, we're going to talk about a few pieces of the Pathways to Oral Health project. I'm going to share some clips of a video series that we created that will help with common brushing barriers that we've come across. I'm going to share a clip of the training video we created on brushing someone else's teeth safely and comfortably. And then we'll talk about how to talk with dentists about accepting Medicaid by using a toolkit that we created. And then we'll learn how to find a dentist in Kansas who accept and or have experience working with people with disabilities, including those who use sedation. And then lastly, I'll share other resources that we have created to make oral care easier for everyone that's involved. I want to start off with the question we often hear like, why is oral health so important? And poor oral health does not just affect the mouth, it affects the whole body. It can make it painful to eat, causing weight and nutrition issues. It can make it harder to speak clearly. It can affect how someone feels about themselves. It can also lead to infection and other health problems, making it more difficult to stay healthy overall. And as you all know, individuals with disabilities face barriers when performing oral care at home and or the ability to be able to go see a dentist. And this can create additional impacts on their overall health. And when issues in the mouth like cavities or gum disease or toothaches, if they go untreated, it can really cause other systemic issues. So gum disease not only causes bad breath, but it is also connected to heart disease, diabetes, pneumonia, several other things. A toothache or a cavity can cause increased irritability. It can cause acting out, maybe refusing to eat, poor sleep. And individuals with disabilities are at a much greater risk for all of these barriers because of the barriers that they face. So let's dive into what those barriers might look like at home, and then we'll dive into what it might look like at the dental office. So at home, taking care of their teeth can be extra tough because they may face additional physical, sensory communication issues or behavioral barriers that make daily oral care and dental visits more difficult. Some of the barriers these individuals can face at home might be some motor skills and coordination issues. Maybe holding and maneuvering a toothbrush can be challenging. Maybe it's hard for them to move their arms. Maybe it's their hands are too shaky. Um, so those are some of the motor issues we've kind of heard about. They could have sensory sensitivities or oral aversion. So some people dislike the feeling of brushing or the taste or texture of the toothpaste or anything in their mouth. There could be a communication barrier. So it may be hard for someone to understand maybe the steps of brushing their teeth or they might not be able to express, like if it's uncomfortable, which can lead to like fear and anxiety and even resistance to wanting their teeth brushed. And then there's behavioral barriers that they can face. They can have maybe a strong gag reflex, or even be completely resistant to brushing because they do not like someone else in their personal space. All of these are not intentional responses, but often because of discomfort or confusion or even just sensory overload. And as their caregiver, knowing the different strategies to use at home to overcome these barriers is key. And we're going to talk about some of those here today. Because we know how difficult it can be at home, as part of our work in the Pathways to Oral Health project, we created a short video series made specifically with individuals with disabilities in mind and their caregivers. These videos address everyday brushing problems and show simple, practical solutions that you can do at home. So there's 7 different videos in the series. There's the introduction video that kind of tells you what it's about. There's one about different grips that you can use on your toothbrush. There's one about any mobility issues, like if you can't get your hand up to your mouth. So if movement is a challenge, it kind of goes over some solutions there. How to get toothpaste out of the toothpaste holder. If there's gagging is an issue, flossing, how to get some floss in there, or even just different brushing positions that they can do. So today we're going to start with a few of the videos. We're going to start with that intro video here. Let's see.
Brushing your teeth is something many people do without thinking. But what if it isn't that simple? Brushing can be tricky for people living with disabilities. Your body might not cooperate. Holding and moving the toothbrush to brush can be difficult, and it's easy to forget to take care of your teeth and gums. You deserve a healthy smile. This video series was made just for you. It will show you easy tips to help make brushing your teeth simpler, no matter what you need. You'll learn some great tricks to try out for yourself. You'll learn ways to gag less, make flossing easier, and find brushing tools that work for you. Brushing can feel easier and more comfortable. A healthy smile helps you feel good, and taking care of your teeth and gums is a big part of taking care of yourself. Your smile is worth it. Let's get started by watching the video series and reviewing resources at pathwaystooralhealth.org.
Awesome. So as you see, they kind of demonstrate several different areas that I just talked about. I want to go ahead and show you a couple of them today. The next one that we're going to watch is on, I believe, gagging. Maybe.
Taking care of your teeth can be hard if you are prone to gagging. Here are some tricks that help. Using toothpaste with fluoride is the best way to keep your teeth strong. But if toothpaste makes you gag, try a different flavor that you like better, or one that doesn't bother you as much. If that doesn't work, you can try brushing with just water. Use a wet toothbrush with no toothpaste. After brushing, rinse with a fluoride mouthwash to help protect your teeth. As you become more comfortable with brushing, you can try using a tiny bit of toothpaste, a pea size or less. A small amount is enough to clean your teeth, and less foam can help with gagging. You can also try non-foaming toothpaste. Some toothpaste contains sodium lauryl sulfate, or SLS, which creates more foam. Lots of foam can make gagging worse. Choosing an SLS-free option can make brushing more comfortable. When brushing your teeth, sit up straight and tilt your head a little forward. This can help stop gagging. Try not to move your toothbrush beyond your back teeth. Go slow and be gentle. Brushing too fast or hard can make gagging worse. Take your time. Breathe slow and deep before you start brushing. Staying calm can help stop gagging. Distract yourself. Listen to music, watch a video, or hum a song while brushing. It can help take your mind off of it. Try brushing at different times of the day. Some people gag less in the evening. Try some of these ideas to see if they help. Your smile is worth it. For more oral health tips, visit pathwaystooralhealth.org.
Awesome. So as you can see, the videos offer several different tips and tricks throughout them. We try to get as many different options in there as we could. There's a ton in there, so it's probably some that you'll have to rewatch a few times just to hear all of them that are in there. We're going to watch one more here.
Brushing your teeth is important for a healthy smile. If you have difficulty gripping a toothbrush, there are simple tools that can help. Let's explore a few options. Adding a thicker grip to your toothbrush can make it easier to hold. You can use a washcloth and rubber bands, a bicycle handle, a tennis ball, or even foam tubing. Special grips like Velcro straps or holders can help keep the toothbrush in your hand. It's like a strap that helps hold a spoon so you don't have to grip it tightly. A power toothbrush can be another great choice. It has a thick handle that's easier to hold. You don't have to scrub, just move it from tooth to tooth, and the brush does the work for you. Everyone deserves a healthy smile. Try different options and see what works best for you. For more oral health tips, visit pathwaystooralhealth.org.
So we wanted to really showcase that sometimes even doing something as simple as adding a tennis ball to the end of your toothbrush can really make a huge difference for somebody who can't fully grip their toothbrush. And then we also wanted to show maybe some store-bought things that you can find that are like specifically made for this. So we kind of wanted to show that whole range of things in there. So now you've seen a couple of the videos, let's kind of talk about how you can use them. So the videos were made with individuals with disabilities in mind. So they were created for them to be able to watch alone or be watched with a caregiver beside them. So you can either watch the videos together and use it as a way to model like what brushing should look like. You can pause the video and practice like the different things that are in there. And then you can also use it as a visual to help create like a consistent routine with them. The videos can also help parents or caregivers learn different positioning techniques or tips for reducing sensory challenges, and different ways to adapt that brushing to meet the individual's specific needs. And you can really adapt each tool to work for different individuals. So over time, this shared learning can really build confidence, not only with the individual, but with you as their caregiver as well. It can also reduce resistance to brushing, and it just makes daily oral care more successful for really just everybody involved. Another thing about the videos is you can kind of adapt them for individual learning styles. So one tip that I like to let people know about is, you can watch it with the captions on. Others might benefit from maybe slowing down the video playback speed, or even just breaking it into little segments can sometimes be easier to understand. So these videos aren't just educational, but they're really designed to kind of help build confidence with both sides of the brushing. But sometimes brushing independently isn't really possible, and that's when parents and caregivers really step in. So, brushing another person's teeth can be kind of awkward at first, but with the right approach, it can really be safe and comfortable for both people involved. So, we created a training video that covers how to do just that. So, we're going to watch a little segment from that video about positioning.
As you begin, talk through each step. Let the person know what you're doing and speak in a clear, calm voice. This helps build trust and makes the experience feel safer and more comfortable. Make sure the person is sitting up straight as possible and feels comfortable. The room should be well lit and warm to help them relax. Soft music in the background sets a calming mood. Before you start brushing, take a moment to gently check inside the person's mouth. Use a small flashlight, being careful not to shine it in their eyes. Look for anything unusual, like food stuck in the cheeks, sores, or swelling. If you notice something that doesn't look right, stop and tell a nurse or
Okay, so as you can see, it kind of shows different little tips and tricks here and there. They won't work for everybody, but we're hoping that maybe even just one of them will work and be helpful for you. So that's definitely a good one to watch all the way through. There's a lot more segments to that video. That video is about 8 minutes long, so it's a lot longer than the other short little ones I just showed you. So as many of you know, brushing is not always that easy, and some are very resistant to brushing. So in a portion of that training video that I just showed you, we do cover tips and tricks on how to make that process smoother. So I'm going to share a little clip about that.
Every person is different. What matters most is finding what works for them. You're not brushing for them, you're brushing with them. Sometimes brushing doesn't go smoothly. The person may turn their head, close their mouth, push your hand, or gag. This can be hard, but it's normal. It often means they feel scared, uncomfortable, or unsure. Before you start, check in with yourself. Are you feeling rushed, tired, or frustrated? Take a deep breath. Staying calm helps the other person feel calm too. Change your position. Try brushing from the side or slightly behind. Standing right in front of them may feel scary to them. Give choices. Ask, do you want the green brush or the blue one? This gives them some control. Use soft music or talk gently to help them relax. Use a mirror so they can see what's happening. Try small changes to help them feel safe. Use a smaller or extra soft toothbrush. Try a 3-sided brush to make brushing quicker. Choose a children's toothpaste with fluoride. Use a foam mouth rest to support their jaw and keep your fingers safe. If they gag easily, start brushing at the front of the mouth. Help them lean forward so spit and foam can drain from their mouth. Take a break to watch for signs of stress. If gagging happens a lot, talk to a dentist. Brushing just a few teeth is progress. Praise their effort. Over time, this helps build trust. You can also reward the person after brushing with a favorite activity. Some days will still be hard. That's okay. It doesn't mean you failed. It just means the person needs more time, or they may be dealing with a fear, pain, or remembering an experience from the past. Be patient and kind. If brushing continues to be difficult, talk to a nurse or dentist. They may have new ideas or tools that can help.
So again, there's a bunch of information like jam-packed in just that little segment. And so I really encourage you guys to watch it multiple times, because each time you watch it, you'll pick up a new little tip and trick that might just work for you. So to kind of help make that easier, we wanted to make a list so that it's really easy to find and get the information you need at a really quick glance. So we created a resistant to brushing document that helps give you those tips and tricks that we talk about in the video. And then we also created a booklet of all the different kinds of adaptive aids that we talk about in the videos as well. There's so many different aids out there. This is really just like a handful of them, but it's a great place to start. The booklet itself will tell you what is the name of the adaptive aid, what it does, and where you can find it. So it's a great place to start, and it kind of gets your wheels turning about, oh, well, this works, so maybe we'll try something like this. There's also the Changing It Up Tips and Tricks book, and that'll teach you things like, maybe putting the tennis ball on there or using rubber band or something like that. So maybe more things that you'd find just laying around your house, not necessarily have to go out and buy. And you can find both these resources on our Pathway to Oral Health website on the resource page. And then you can also find it on the individuals page right below the videos themselves. And we'd love to hear from you. We want our resources to be as useful as possible for you guys. So if you're facing a challenge at home and you cannot find a solution, we want to know and we want to be here to help you and help guide you towards something that might work for you. So switching to the dental office setting, there are several different reasons why there is a barrier in the dental office, and Pathways to Oral Health is really like trying to tackle all those barriers. A common thing that we hear is that providers do not feel like they have enough training to see individuals with disabilities. And this causes dentists to turn patients away just because of that. Another big barrier is due to the lack of Medicaid providers that there is. So it can be very difficult to get appointments. And when you do get an appointment, the wait times can be just absurd. A lot of individuals with disabilities really rely on somebody else driving them to appointments. So they're not only making dental appointments around their personal schedule, but they're also making it around the driver's schedule and the dental office schedule. So it can get really tricky to just schedule an appointment in general. And maybe the office is not equipped to work with patients who have disabilities. So maybe it's not set up for easy wheelchair access, or like so they won't be able to get into the operatory. Or maybe they don't have items to help with sensory issues at all. And these are just a few of the examples of barriers that are met when it comes into dental offices. We know there's so many more, but these are some of the main ones that we're really trying to make a difference with.
Abby, can you clarify what
Yeah.
the I can't even say it.
Operatory?
Yes, can you clarify what that
Yes.
is for people who don't have the
Yes.
dental language speak? Thank you.
I can, yes. So an operatory is the room that you go into to get your dental work done. So it's where the doctor or where the hygienist actually clean your teeth or do your dental work. So that's where the chair is. And sometimes those rooms can be really, really tight. And they're not able to get like a wheelchair in there, or sometimes they're not able to move the chair itself to make more room. But the operatory is the room that you go into to get your dental work done. So one thing we created to kind of help decrease these barriers is called the My Dental Care Passport. And the goal is to set the appointment up for success from the minute you guys walk into the door. Not only does it prepare the dental staff, but it also gives the patients the peace of mind knowing they know all of it beforehand, and you don't have to repeat your story over and over and over again. Or maybe they have anxiety. That'll trigger them. And this way they kind of know that, like, okay, they know that ahead of time, so I can kind of relax a little bit. This document comes in Spanish and in English. And it's something that you can fill out on your computer online, or you can print it off and fill it out online. But the key is to do it prior to your dental appointment. So this document tells the dental staff all about the individuals with disabilities. So it covers things like general information about them, like their name, who their contact person is, and what their info is. How do they communicate? So are they verbal, nonverbal? Do they like to write things down? Do you need to talk to their caregiver or directly to them? It'll discuss any mobility issues they might have. So are they in a wheelchair? Are they in a walker? Do they use a cane? Do they need help getting in and out of the chair? Things like that. It talks about any sensitivities they might have. So any sensitivity to sight, sound, smell, taste, touch, position, kind of all of the different sensory issues or sensitivities that can be out there. It's quite a robust list there. It
Abby,
even talks about
Abby, sorry, there was a question. These resources in the PDF form, I know the passport is in Spanish. Are all of the documents in Spanish?
Great question. So, we actually are in the process of translating all of them over into Spanish. Right now, the only one that's in Spanish on the website is the passport. The toolkit that I'm getting ready to talk about here shortly, that is in the final process of getting translated over into Spanish and should be up on the website later this week. And then this resistance to brushing and the we're getting ready to come out with another sensory document will be translated into Spanish. So if it's not translated currently into Spanish, it will be. It's in the process of being done.
Great, thank you.
Yep. Okay, so this document also talks about maybe different past dental experiences, like what worked, what didn't work. That way they kind of know ahead of hand, like, oh, this worked last time, so let's try it again. And then it'll also give an area that you can give a brief medical history. This area is just really for like the individual to write down maybe like what their diagnosis is or any big medical concerns that they want to make sure the dental team knows. The office will still have you fill out a medical history, so it's not intended to be a full medical history. It's more just like the key things that they might want to know. And all of this information is so helpful to the providers to know before you come in. So that way they have time to prepare themselves in the office for when you get there and it'll all be ready for you. So for example, if you check that maybe they're nonverbal but communicate best by writing, they can have maybe like a whiteboard or a pen and pad ready there for you when you get there. Or if you check that maybe sound is a sensory trigger for you, they can have something like noise canceling headphones waiting for you at the waiting room so that you can put them on as soon as you get there so you're not oversensoried by the time you even get into the chair. All of these tiny little adjustments make a really huge difference in the appointment, and sometimes it can be the thing that makes or breaks the appointment. While daily oral care at home is essential, the regular visits to the dentist are really just as important. And for individuals on Medicaid and those with disabilities, accessing dental care can sometimes be a really big challenge for them. And as an advocate for your loved ones, reaching out to either their dentist or your dentist to discuss these challenges can make a really big difference. To support you in doing that, we've created a toolkit that I said is also in English and about to be in Spanish later this week. And it covers really 5 main topics to help you start that conversation with your dentist. So there's a fact sheet that's included in the toolkit. It's designed to be given to your dentist to actually hand to them that explains the challenges that people with disabilities face and why Medicaid acceptance is so important. And it also includes oral health facts, like why their participation matters and what they can do themselves. There's a whole sample email in there that you can send to the dental office. And there's also a phone script that you can use to help you start that conversation. And of course, you can just use your own story. They are so powerful by just saying your experiences. There is a section that goes over talking points that can help you start that conversation while you're there, or even with other people out in your community. And then we have pre-made social media messages on there, so you can stick it on all your social media pages and help spread the message out there and the awareness about it. And we also include the resources on Oral Health Kansas and Pathways website in there as well, so they can know where to go to find more information.
I just want to say one thing about that. And the reason why Abby just shared on how to talk to a dentist about taking Medicaid. We are finding a lot currently are not taking Medicaid. However, Oral Health Kansas has worked really, really hard in advocating for us at the in Topeka at the legislature to get more funding for adults and individuals with Medicaid to have a higher reimbursement rate so that dentists will take Medicaid. So many of our loved ones are on Medicaid, or if they're not yet, they will be on Medicaid when they become adults. And it's important to, obviously, everything you've heard tonight is why it's obvious to take care of your health, but it's important to advocate, especially in some of these smaller towns that may not have a lot of dentists, and the only dentist or the only couple of dentists don't take Medicaid. So trying to advocate, and it's such a big responsibility for all of us in the disability community to advocate not only for our loved ones, but for those that come up behind us. Make the life a little better for the next generation, next person who comes along. So I
Yeah,
just
and
want to
advocacy.
say that.
Yeah, advocacy is not always supernatural for people either. I mean, it can be a really scary, daunting thing to do. And that's kind of why we created this toolkit, is so that you'll have a place to start and a conversation to have with them, and you kind of know what to say. So it's really just kind of get you going. And then I promise you, once you get going, it's so easy. Like, it's so much easier because you just start sharing your story. And honestly, your stories are so powerful. They really do make a lot of movement in there. And like she said, we've been fighting for it at the Capitol to get better reimbursement rates. That's the number one reason why dentists don't want to accept Medicaid. So last year we were able to get a good amount of money applied to that. And then this year we kind of hope to finish that process. So it's right up there with private insurance. And that's when dentists we're hoping will start to kind of take on more patients. We've already kind of seen a little increase in Medicaid providers. So we're hoping by finishing that out, that will kind of really ramp up. And that's something that we're really going to focus on in this next year, is kind of letting those providers, getting the word out there that, hey, this has happened. And hey, you can treat individuals with disabilities. It's not scary. It's not as hard as you think it is. And we're doing a lot of education with the dentists themselves on not only this is what Medicaid now looks like, but you can also treat individuals with disabilities. So we're doing both of those things in hopes that more dentists will start accepting it. So with it being difficult to find a dentist to provide care, we created a whole section on our website to help with just that. So here you can easily access a list of dentists who do accept Medicaid and if they're taking new patients or not. We also provide another document that has questions that you can ask while calling different dental offices. So you kind of know what to ask that way. And then there's also a section about sedative dentistry. These lists are always changing as we hear of dentists that either do sedation or are accepting Medicaid or are like really good at seeing individuals with disabilities. We update this list. So keep checking it, keep looking at it, keep referencing to it. And then please don't hesitate to reach out if you're really struggling, because we will try to help connect you with somebody. We have a ton of other resources on our Pathways to Oral Health website. The resources are really spread throughout the website, but we also have a section on our website just for them. So our most current resources that we come out with, so when we come out with that Spanish toolkit, you will find it right at the top of the resource page there. You can filter the resources by disability. Most of them have English and Spanish options. There's video options. There's PDF options. There's brochures. There's all different kinds of resources on there. There's stuff for dental providers, but there's also stuff for parents and caregivers. Here is where you can find maybe this Behavior Speaks poster. This is really cool because you know they can't always communicate when they're having dental pain, and sometimes that can present in so many different ways. Like they can be acting out. Maybe they start refusing to eat. Their health in general can just start declining, and a lot of people don't even think to look in the mouth and be like, oh, maybe there's a toothache going on in there. So we created this poster to kind of make awareness around that. And then you can also find the adaptive aids, which goes along with those videos, which are the tools that you can use to kind of make brushing at home easier. You can find them on this resource page as well. So you can find different resources on the individuals page of our website. This is where you will find that video series that I talked about earlier. This is where you will find the resistance to brushing document. And then there's also information on options for paying for dental care. The Find the Dentist resources are on this one as well. And then there's information about advocacy and how you could be an advocate. And that's also where you will find the toolkit that I just talked about as well. And speaking of advocacy, part of the Pathways Project was to create a lived experience group. And this is a group made up of caregivers and parents of individuals with disabilities. And we meet once a month and discuss a wide range of topics. So we help problem solve any dinner related problems that they're having. We talk about solutions. We discuss different projects that the Pathways is doing and ask their input on it. And we talk about how to advocate for their loved ones. It's a really great way to connect with people who understand what you're going through and offer advice and problems to solve the issues that you might be happen to be having. So we're here to listen. We're here to help when we can. And we're inviting you to join if you like. And I just want to take a second to acknowledge something. I mean, you as parents and caregivers, you make a huge difference. You're often the ones providing that daily support with brushing and flossing and building that routine with them. And you're kind of what makes oral health possible sometimes. You also, you advocate for them. You let them know what their needs are, especially at dental appointments, and you help providers understand what works best. And you ensure that their oral health stays a priority despite the challenges you might be facing. And I just want to encourage you to keep going. We see you, we hear you, we know how hard it can be, and we're here to help. So please don't hesitate to reach out if there's anything that we can help you with.
I would also encourage you to share this information with others. This will be recorded, so whether you're watching it live now or watching it on our YouTube page, share this with others. Share these resources you learned about. One person, I remember when I first started doing some sessions and somebody said, "Can we share this information?" And I'm like, absolutely. It's so important to have everybody knowledgeable about all the resources. That's what we want. So please share all the resources that you've learned about here tonight. Share, where they can watch this video later. Obviously, a little plug, our YouTube page has more than just this video, lots of different topics over the past several years that we've done these. So thank you, Abby, for presenting and being here with us tonight. Does anybody have any additional questions? I'll give it a couple of minutes. See if anybody wants to type anything in. Oh, well, thank you, everybody, for joining us tonight. We really appreciate it. Thank you. Like I heard Abby say, thank you for all you do for your loved ones and making their life better. Together, we can continue to move forward in providing the best life, good life for all of our loved ones and individuals. So thanks, everyone. Have a great night, and we'll see you next month.